All right, we want to talk about what Rotary Club of Accra Ridge is doing, particularly at the Mallam Atta Government Clinic. And I've been joined by two gentlemen. They'll tell us a lot more about the project. Edem Menka is a member. Isaac Eniwakwa is past assistant governor, all with the Rotary Club of Accra Ridge. Good morning to you, gentlemen.
Good morning. Good morning.
Rotary does a lot of things. You guys keep giving, and sometimes I wonder where that is coming from. But you just love to give, right?
Well, it's our nature, and unto whom much is given, much is required. So Rotary seeks to provide the basic necessities for the communities that we live in. So we use our strengths, we use our networks, and then we make sure that a need is met. So it's the passion, it's the commitment, and that belief that we need to do more for the community that we live in. So that's why we do that. And there are, as you have mentioned, there are many Rotary clubs in Ghana who are doing different things in particular areas. It's either peace and conflict resolution, or maternal and child health, or economic community and development, or we are championing polio, as you are aware. So there are various activities that we all do to make sure the community is a better place to live.
Okay, now, you mentioned maternal health. So Adam, let's talk about this specific project and what you seek to do with the Mallam Government Clinic.
Mallam Atta Government Clinic. Well, that's an existing structure which has been there for a while now. Unfortunately, they don't have a maternity and delivery unit. So what the Rotary Club of Accra Ridge, in conjunction with our partners, Otna and Associates, we are the architects, and then Hive, and also with AMA, we intend to do is to put up a separate maternity and delivery unit, fully equipped to ensure that the market women, our mothers, once they come to the market and they have to deliver, have a safe place where there's delivery ongoing. So that's what we intend to do.
What we're showing on the screen now is the plan as you have it. Can you explain what we're seeing on the screen?
Right, so like you said, that's the maternity and delivery unit. So it's fully equipped, there's a room for delivery, there's a waiting area. So basically the concept is such that it's an open space, neat.
And if you look at it, it's a calm atmosphere. We've done it like in the form of a cocoon. So the women come in there and they are not sitting on the normal chairs you'd expect to find in a hospital. They should come and feel relaxed, have some calmness with them. So this concept is what you see, the bamboo. We want them to have some revitalizing moments when they get to the delivery unit and have some peace. And that is what we seek to do. And as Joy was saying, we want a calm atmosphere for our mothers. So again, you can see the way they are. They are all relaxed, very comfortable, a very nice atmosphere, which we have said is a cocoon. I mean, they come in and they are very calm. They sit down, quiet, calm, and hope to have their babies.
This is interesting because this is purely a private initiative. I wonder how you chose Mallam Atta Government Clinic to be specific. What's the reasoning behind? Is it just because that area is part of your zone,
well,
if I may put it?
Firstly, obviously, like you said, there are a lot of Rotary clubs in Accra, and we are the Rotary Club of Accra Ridge. So when you want to do a project, first of all, you like to look within your catchment area. You look within the catchment area. And we've been going around because of these activities Rotary has been doing in terms of maternal health, sanitation. So we go around, we look at projects or clinics or other health facilities that may need some assistance in the future. And as and when we are planning for each year's activities, we try and put together something to see how best we can improve the lives of the people in that area. And so that's one of the reasons why.
You also have this outreach program that you do in the same specific area, correct?
Yes, I'm sure you're talking about the Rotary Family Health Days. And it's supposed to give the basic care for especially people who do not have the time to go and do regular checkups. So we take it to their doorstep and make sure they are provided. As my colleague rightly said, Mallam Atta, it's a place that almost everybody can attest to their services over the years. But it's unfortunate they don't have that delivery unit and maternity. And the women have challenges when it's time to deliver. They have to be transported far and they sometimes lose their baby. So we thought that why don't we do it for them? So my president and other people went there, and that was one need that they put to us. And so once we decided to go along with it, we're going along with it. It's a private initiative. We are raising funds ourselves, and we're also going to equip the place, the facility with about $40,000 of equipment. They're going to have incubators, they're going to have stretchers, they're going to have BP apparatus, everything in the inpatient and outpatient.
Nice.
It's a fully finished, and we're finishing this by by end of next year. I mean
2019.
2019.
Before 2020.
Before
definitely. 2019.
Okay.
We are done. We're actually cutting sod on the 14th of December.
And cutting sod means work begins right after that.
So how much is the entire project costing?
Well, the physical infrastructure is about slightly over 200,000 cities.
And the equipment is $40,000. And this is being funded by Rotary.
At the current rate, we'll say it's about a total of 400,000.
Okay, that's equivalent to something else. But no, I'm not going there. Okay, but how do we ensure, just finally, how do we ensure that they take care of this facility? Would you still be involved even after you hand it over?
Well, Rotary, we now believe in sustainability. And once we decide to do a project for you, we want to build in some form of sustainability and continuous monitoring. And for the project that we are doing, we are supposed to monitor it for at least the next 5 years.
Okay.
They are supposed to generate income. We want to monitor how they are going to set up, how they are going to maintain it, so that we don't throw money away. So we're going to be there monitoring for the next 5 years and ensure that things are done well. And of course, these are monies that have been raised by donors and individuals, and we want them to treat it as some sacred trust given to them, somebody's funds coming to give it to you for free. And so we believe that we will monitor and ensure that it is done.
Okay.
We are doing so many fundraising activities. Maybe I'll end with that one. We're doing so many fundraising activities, and come tomorrow we are having what we call a Rotary Business Fair, where we are inviting all businesses to come together to showcase what products that they have to the public. Whatever funds we raise on the day would go into the construction of the
venue and time.
Christ the King Hall, starting at 7 a.m. To 5 p.m.
Okay.
There will be some activities for the kids as well, and there will be a business seminar from 9 a.m. to 10 a.m. about how to run your business, trademark, and other things.
And it's free.
It's free.
It's free.
Okay, but if you want to pick up a booth, then you'd have to pay for the booth to exhibit your products. But otherwise, for the general public, it's free. Come and see what we are doing. Come and support us. And we believe that together we can give the women in the market a safe delivery unit.
Safe and better.
Thank you for what you're doing. This is really, really important. We appreciate it.
Yes.
Thank you, Isaac. Thank you, Adam.
Welcome.
All right. Stay with us. One more thing, and then we'll bring you some show business here on our show.